All right, so I have gotten a trillion and one messages and responses from my post that I put on Friday asking about successful back surgeries. Now, in all honesty, I was not going to go live about this today. This was not something that I had planned to go live with, but somebody once told me when you're having a bad day, go out and help two other people. So my reason for doing this is to help other people, and it is by far no means to be a poor me post. It is by no means to be a pity party. So I posted the other day asking if anybody had had successful back surgery, because what do we always hear? We always hear the negative things. We always hear, like, who the bad teachers are, who the bad car dealerships are, what the bad stores are, who the bad parents are, who the bad kids are, what bad surgeries that people have had. We don't hear the good. And I think we need to focus more on that. And why are we focusing on back surgery? Because, Melanie did a whole series in the beginning of April about how wonderful her back was feeling after all the crap went down in November. Well, my back is feeling great still. It is. And if you remember correctly, we were reintroducing some of the flexion exercises. And every time we were doing that, I would start some sort of pain on the opposite side of my back that originally everything started on. So, long story short, it has traveled down my right leg. It has given me numbness down my right leg. It had gotten to the point of pain to where you didn't want to be around me. You just didn't want to be around me. And at first we were kind of thinking like, oh, maybe this is like a tight hamstring. So let's focus and see if it's that. Yeah, not so much. Didn't respond the way it should have if it were a hamstring. So one weekend I had like severe pain again, and the doctor's like, we're going to have to talk about possibly getting an injection. And at that point I was like, okay, can I go right now? I mean, that's where it was. I was like, let me just go right now, because there's not enough ibuprofen out on the shelf right now for me to take that was going to help with it. Okay, so April 18th I went for a cortisone injection in my lower back. Prior to that, I did have an MRI like 4 days prior to it, finding out pretty much what the doctor suspected is that all this time we kind of thought from what I'd gone through that my discs were either pressing out centrally or more to the left, because that's where the pain was. Well, I got one bugger pushing out to the right, and that's what's causing the pain. So ironically, it was exactly the disc that the doctor had suspected by what went on as far as therapy response and things like that, and where my pain was and where my numbness was. So, okay, I get the shot. This shot could take 2 weeks to take effect. Well, let me tell you, it took its sweet flippin' time. So without saying that, I'd be lying if I said I wasn't miserable during those 2 weeks and wasn't very impatient and was expecting more than what I got from it. However, I got about 60 to 70% relief. So I go for a 2-week checkup. And, I'm still going through therapy. Things just are not really responding the way we want them to. My pain has lessened. I was sleeping at night. I have to take my shoe off because right now my foot is numb from sitting. And I'm just going to tell myself it's my shoe. So, therapy was still going okay. I would kind of feel a little relief from certain things. Go for the 2-week checkup at the pain clinic. And the doctor says, well, we can do one of two things. He said, he ran me through a couple of little tests to see like what my pain tolerance was as far as what it was when I first went. And it was either we can do another injection or we can double your dosage of pain medication that I really wasn't taking. Why? Because it wasn't working. I was getting more of a benefit from taking ibuprofen after the first injection than I was from the medication that he prescribed. So I was like, I'm open to another shot. I didn't really think like he was like, all right, well, we can do it Tuesday. Well, okay, tomorrow's Tuesday. So I'm getting my second injection tomorrow. However, there are some things that I've been prepped for outside of this injection, because MRIs from 6 years ago versus a couple weeks ago have shown just a little difference in the way that disc is pushing out. And why? My biggest question along this way was, why all of a sudden is everything on my right side? What in the hell and where in the hell did that come from? 14 years, just issues on the left side, been able to manage them, been able to, come back and forth with it. And ever since then, when my back was great after this past therapy, my right side was like, hey, guess what? It's my turn. And I honestly think that's exactly what went on with my body. So what I was told, and I may quote this wrong, but I'm going to kind of give it a roundabout reason, that I've always had this disc issue. But it was never a prominent issue to where it was causing pain on the right side. Those kind of issues decide when and how they want to present. Meaning, I could have went 5-10 more years and not felt any pain. You could go 5 or 10 more years without even knowing that you have a disc issue until it says, hey, guess what? My turn. Okay? So that's kind of what happened. To be honest, it was nothing I did in therapy because, there was no hey, let me adjust you like a pretzel. Let me stretch you and put you in traction until your hands are on this side of the room and your feet are on the other. There was nothing that was done that would have indicated this was going to happen whatsoever. So, to be really honest, I'm pissed at my body. I'm pissed beyond all freaking pissed offness. And I'm not going to cry. Because, yes, I'm preparing for the best. No, I'm hoping for the best and preparing for the worst because surgery has now become an option. But I'm a stubborn person. So I don't want that to be my option. So I will not go down without a fight. I will probably visit a surgeon or two in the next 4 weeks or so. But they're going to find out that they've gotten in trouble with someone that they're going to cut on because every question in the world is going to come out of my mouth. Honest to God, because I've heard the horror stories. I don't want to hear them anymore. I don't want to be a horror story. I want to be someone who has kicked ass through this. So, as I slobber all over the place and cry, tomorrow I go for my injection. So I'm hoping and praying that the injection will bring me the rest of the way as far as pain and numbness. Now, before anybody goes posting on here, trust me, I know this is not going to heal my disc. I am not in the clouds about that. I have been educated, beyond educated, in the past 6 months as to what's going on with my back and what could happen. So yes, I am fully prepared to hear an answer. I don't want to hear in a few weeks. But those doctors are not prepared enough to see me if they're going to. So, done. Okay, wait. Totally done. I know it's not going to heal the issue. I know it's a temporary Band-Aid. But here's what my fingers crossing are about. So what probably caused all this is inflammation. It just wasn't... because people with discs don't have to have surgery. They can go through this therapy and be perfectly fine and not have issues. Really? Get out of town. Yes. Okay? So I'm going to go with the fact, in my mind, because facts, this is a fact I'm pulling out of the air, but it's going to be it. I'm going to go with the fact that I still have some inflammation and that this second shot that I'm getting tomorrow is going to bring down that inflammation to where things are not pushing on my nerve so much, because that's the scariest part. There is something that's pushing on your nerve, because after it pushes on your nerve for a certain amount of time, there's not much more you can do. You can't, you got to kind of get something out of somewhere. You got to take something out of inside there. And as real as that may be, I am not going to face that yet. I'm going to take the next 3 weeks one day at a time. I'm going to take it one therapy session at a time. And what therapy am I going through? Remember, I went through this doctor. I'm not going through physical therapy because, let me just tell you something of what I was educated on. Yeah, that didn't work. Maybe it works for some, but it didn't work for me. I went through it. It helped relieve the pain. But if I were going right now for physical therapy, an orthopedic, whatever it was, would be like, hey, let's give you some more therapy. Let's send you for some more therapy. Let's send you for some more therapy. Let's put you in traction. Let's put you in inversion. I've asked about that. It's not a natural way of healing this. And I'm not saying healing it like, hey, It's going to shove that disc right back in there. Because seriously, if there was an exercise that could do that, my ass would be doing it 4,000 times a day. But it's not the fact. So I know that this is not going to shove the disc back in. I'm hoping that there's still some inflammation we're working with, and the cortisone will do its job like it's supposed to and bring that away. If there's still numbness in my foot, I'm going to have to face the hard facts. I'm just going to have to, because it is what it is. So with that being said, you can comment on this whatever you want, but if it's going to be something negative as far as like, my sister's brother's aunt had surgery and now they are in a wheelchair, I don't want to hear it. I really don't. I feel sorry for your sister's brother's aunt if that's the order of family that I just gave you, but I don't want to hear those stories, because that is not what's helping people make these decisions. So yes, I'm trying to help other people who are in the same position as me, because I've gotten lots of messages, I had lots of responses that, yes, I'm still going with surgery is not the be-all, end-all option. I'm still looking. I'm still trying. But I know that it's possible that it could be, it might be something I have to do. I won't be happy about it. I won't be, thrilled. I'll be scared to death. I'll probably need some sort of drugs to take the week of the surgery, so I'll be calm. But I'm just trying to say, like, hey, there are other alternatives. And sometimes when you think you're fixing it or helping it, you're really not. So make sure that you're going to somewhere where you feel so ultimately freaking comfortable that when they do tell you you need surgery, you cry and you believe them, because you know that they know their shit. So yeah, that's where I'm at right now. And now that I've cried for like 20 freaking minutes, I'm done, because I just don't want to make this a bad thing if it's something that has to happen. So yes, if it is something I have to happen, I'm going to totally document it, because you know what? I'm going to be a freaking success story if it has to happen. I'm going to be the one who's like, guess what? I had back surgery X amount of years ago, and I can skydive and do gymnastics and karate and whatever else there is that people can't do after they've had the back surgery. I will defy the freaking odds. I don't care. I really don't. I'm not going down without a freaking fight. So if any of you guys have these back issues, and like I said, you have a successful surgery, I've seen a lot of people post, I've gotten a lot of messages, and it's been reassuring. It really has. So if that's you, or if you're like, hey, I'm where you're at, I'm not sure what to do either, comment, question me. And then these other people that are out there that have had success stories can help us. They can help reassure us and realize that, shit, maybe this is my only alternative and I have to do it. I don't have a choice, but I'm going to do it. But like I said, I'm giving myself a good 3-4 weeks. The only fear that is in the back of my mind, like I said, I know this doesn't heal my disc, so it's always going to be there. So obviously my career, I teach fitness classes, I train people, that's like my livelihood. So that's where I fear, like, maybe I'll do something wrong and set everything off. So that's where the worry is, because I honestly have not worked out since the beginning of April. So I don't really know what effects it would have after all this is said and done. I mean, I know I'm not going to be able to do exactly what I used to do, because some of the stuff was, pretty high intensity type crazy jumping stuff, and that may be out of my line of work, but that doesn't mean I won't kick everybody else's butts. So that's all I've got today. Like I said, this was where I went with things. Come along with me this week while I have my shot and see how I'm feeling on Wednesday, Thursday, Friday, and see what's going on. Because I have a feeling, and I'm going in this with complete and total optimism, that this second shot, because sometimes the second shot does it, I mean, you hear people who are like, well, I had 2 shots and everything's been fine for 400 years. So maybe that's going to be me, all right? I'm hoping. So you guys have a great day. I'm sorry I got blubbery on you, but hey, this shit's real, man. And I'm really sad that my dog walked away, because he totally walked over. I thought he was going to do some background dancing and stuff, but that's all I have for you guys today. So tomorrow is my injection, and I will be back on Wednesday to let you guys all know how it goes. So have a great day. Talk to you later.